Good morning, everyone. I'm Eszter Bakó, and I want to introduce my PhD work. The aim of my work is to investigate and understand the effects of topical herbal preparations on human musculoskeletal system and circulation. I'm a pharmacist, and my vision is that the best product should be prepared based on the best science. Herbal therapies, especially essential oil therapies, are often used without scientific knowledge. Therefore, our aim is to provide more evidence for these therapies. To fulfill this goal, I have two projects, and let me introduce my projects in more details. My first project is a meta-analysis. We investigate the topically applied essential oils, pain-reducing and stiffness-improving effect in musculoskeletal disorders. The manuscript have been submitted to Phytomedicine journal, but it was rejected. So currently we are working on the next submission. The background of this project is that musculoskeletal disorders are a global issue because a lot of people suffer for pain. Essential oil therapy is a complementary treatment technique to relieve musculoskeletal pain, and essential oils are often applied by massage. The benefits are controversial because the lack of scientific evidence and just a few high-quality reports are available in the literature. So with this project, our aim is to provide more evidence for clinical use of essential oils. We have established a clinical question, which is how effective are topically applied essential oils in musculoskeletal disorders. And we considered those articles in which adults with musculoskeletal disorders were enrolled, and essential oil therapy was compared to placebo or no intervention group, and the main outcome was pain intensity. So after the selection phase, finally we gained 12 eligible articles. In this slide, you can see the results of the multi-level meta-analysis. Pain intensity is our main outcome because this is the main reason for suffering in musculoskeletal diseases. Pain was measured by a visual analog scale in the trials in different time points. Based on this, we have created 3 subgroups, which are immediately after intervention, 1 week after the intervention, and 4 weeks after the intervention. Despite the fact that different essential oils were applied in the trials, we can conclude that the effect of essential oils is beneficial to treat musculoskeletal pain, and the most pronounced effect was observed immediately after the intervention, and this effect decreases over time. So we can conclude that essential oil therapy is beneficial to treat musculoskeletal pain. This multi-level meta-analysis was performed in case of stiffness as well. 3 articles were involved in this analysis, and we can conclude that essential oils are beneficial to treat musculoskeletal stiffness as well. So in summary, the strengths of this meta-analysis that this was the first meta-analysis which focuses on the topical application of essential oils. Only randomized controlled trials were included, and we investigated the time dependency of the essential oils. Limitations are blinding because it was difficult to hide the smell of the essential oils. the small sample sizes and the heterogeneity. So we can conclude that essential oil therapy is beneficial in reducing musculoskeletal pain and stiffness. It should be applied repeatedly, weekly, because the pain relieving effect decreases over time. And essential oil therapy is a good add-on treatment because it contributes well to the conventional therapies. So in summary, topical essential oils are recommended in musculoskeletal disorders. No adverse effects were reported, and the most pronounced effect was observed immediately after the intervention. Design of experiments should be planned in the further trials, and these factors are detailed in the manuscript. My second project is to write a protocol for a clinical trial in which we investigate the effects of topical essential oils on human circulation. So the background of this project is that there are sport creams or warm-up products on the market which contain mainly essential oils. For example, in case of menthol, this effect is proved, but our aim is to investigate the effect of other essential oils on microcirculation parameters. So we established the question, how do the topical essential oils influence the skin circulation in humans? And our main outcome will be the skin blood flow, and we will measure by laser Doppler or laser speckle technique. So the clinical implication is we will provide more evidence on hyperemic effect of these essential oils. Thank you very much.
Actually, I wanted to start the questions during the 12-month progress report. Since we are regarding your meta-analysis, so we are headed towards personalized medicine, and of course, doing meta-analysis is great for a general population. But I'm also curious whether the studies that you included mention any specific groups, like older persons, like even differences between genders, or older and younger, or sports injuries and osteoarthritis, or what kind of patient group actually can benefit in the highest percentage from these essential oils. Do you have anything on this?
Yeah, thank you for your question. Different groups were involved in the trials. For example, in one trial, elderly people were involved. So in case of high age, essential oils are beneficial. And the other group was athletes with pain of athletes with back pain. So in case of this group, it was also effective. So the trials investigated several groups, and the main conclusion was that in each group was effective. So there were no difference.
I think your two topics are connected to each other. At the second one, you are dealing with the skin, and your methodology is good enough to investigate the circulation of the skin, but the first topic is about the muscles. Do you have any idea how to investigate the deeper layers, like the musculoskeletal system?
Thank you for your question. We were thinking about this problem, and we are planned spiroergometric measurement, but this project is in early stage. But we are thinking on this problem. Thank you.
Thank you for your presentation. I would like to ask two things that interest me. First of all, how did you measure the stiffness of the muscle? Because the pain I understand, but the stiffness I'm not really sure. And second of all, about the essential oils that were used in pain reduction. Were they based on the same plant or some differences you discovered, you investigated?
Thank you for your question. So stiffness was measured also by a visual analog scale. So every patient reported his or she's feelings about this. And the second one, different essential oils were investigated in the trials. There were no connection between the trials, and for example, lavender essential oils was a popular chosen.
Okay, on your first study, by the way, very nice, and don't worry that you got rejected. You are not the only one, and actually, we all, all the seniors here got lots of rejections. So don't worry about this. Of course, it wouldn't make you happy, but that happens. Today there is such a kind of competitions, and then the decisions are not always, absolutely correct. So, with the next journal, hopefully that happens. So I have two questions. One is related to your study. Isn't it too early to say that there is a decrease in response? Because the studies are just few. And then actually there is an overlap with the diamonds, as I see. So maybe this is just, this just happens. That you don't have enough studies. So did you do any statistical analysis for that too? The decline of response by time.
Thank you for your notes. So there are just a few trials involved in the meta-analysis, but I think the tendency of the effect is clear. So despite the fact that...
this is a tendency.
Yes.
And then you have lots of, I would say, that variabilities and heterogeneities on this. So, I would just call this tendency instead of, just a pure fact that this is happening.
Okay, thank you. So this is a tendency, which is obvious based on
the other thing
result.
that did you make changes before the second submissions in your manuscript? This is just for everybody. It would be interesting that how somebody handles that, or you just send it right away without changing?
We received, we didn't receive any comments about the first submission. So after the formal changes, I think we won't change the article.